Hey, ladies and gentlemen, and now I would like to tell you of the whole true facts about the anxiety, which is anxiety lesson, the third one. The other symptoms of anxiety, according to NAMI, there are different types of anxiety disorders. So, symptoms depend on the individual and the type of anxiety they have. However, all types of anxiety present several key symptoms. Emotional symptoms include feelings of anticipation, tenseness, irritability, dread. Physical symptoms include a headache, fatigue, sweating, disturbed stomach functions, heart palpitations. Those are the ones. Diagnosing anxiety palpitations. Heart palpitations can be a symptom of anxiety and not a major cause for concern, providing the person is aware of the trigger and the palpitations stop when the anxiety subsides. An article in the American Family Physician Journal suggests palpitations due to anxiety are more common in people who experience a lot of daily irritation and those who are sensitive to sensations in their body. Doctors diagnose heart palpitations under five categories of causes. Cardiac arrhythmias such as bradycardia, psychiatric linked to anxiety disorders and panic attacks, drugs and medication, non-arrhythmic cardiac causes such as valvular disease, extracardiac causes which come from outside the heart. To diagnose anxiety palpitations, a doctor will begin with a screening questionnaire. This will help them identify people who are likely to have palpitations from anxiety. A doctor will refer anyone who passes a certain score for monitoring. A doctor may use a Holter monitor or a transtelephonic event monitor. A doctor may consider using a Holter monitor if a person experiences palpitations on a daily basis. A Holter monitor is a basic ECG device that continuously monitors a person's heartbeat over 24-48 hours. The person must wear the Holter device throughout the monitoring period and record any symptoms. A transtelephonic event monitor is smaller than a Holter monitor and does not run for the whole period. Although the person wears it continuously, they operate the monitor manually. Some types of transtelephonic monitors require a person to hold it against their chest only when they think they are experiencing palpitations. The results of these assessments must something, I don't know. Anxiety palpitations or AFib, according to the American Heart Association, AHA, AFib, short for atrial fibrillation, is an irregular heartbeat that can increase the risk of a stroke. A fib can produce symptoms that are similar to anxiety palpitations as the heartbeat becomes rapid and causes chest pain. The table shows the main differences between symptoms. Anxiety palpitations. Okay, on the first box, anxiety palpitations. People with anxiety are more aware of their heartbeats, so they panic more. Anxiety palpitations are gradual. Racing heart maintains rhythm. And on the second box, AFib palpitations. A person with AFib may be less aware of their heartbeats before palpitations begin. Palpitations are sharp and intense. The heartbeat flutters, losing rhythm. So that's the one. And then next, we're going to be talking about, which is, what does it mean when you wake up with a racing heart? That's the next one here, see? I did a screenshot. I screenshot this all online on the phone, and then I print this from the phone through the printer, with the phone connected to the printer, like PDF and something, with the Wi-Fi password in it. What does it mean when you wake up with a racing heart? Okay, stress or anxiety, diet, and then anemia, nightmares, sleep deprivation, sleep apnea, AFib, diabetes, hormones, fever, medications, seeing a doctor, and summary. Waking up with a racing heart can be confusing and scary, but it is rarely a cause for concern. Many factors can cause a person to wake up with a racing heart, including diet, stress, sleep deprivation, and arrhythmia. Sometimes upon waking, it may feel as though the heart is beating very fast or pounding in the chest. A person may also feel shaky or anxious when this happens. Sometimes, upon waking, it may feel as though the heart is beating very fast or pounding in the chest. A person may also feel shaky or anxious when this happens. A racing heart may feel similar to heart palpitations or arrhythmia, although this might feel worrying. It is typically linked to everyday factors such as anxiety and diet, and it is usually only temporary. A person may also wake up with a racing heart due to the presence of a medical condition such as diabetes, a sleep disorder, or anemia. People who experience this regularly may want to check in with their doctor, who will be able to determine or treat the underlying cause. This article takes a look at the reasons a person may wake up with their heart racing and when to see a doctor. High stress or anxiety. Here, I'll show you the picture. Now this man here is putting his hand on his chest. See? You see what he's doing? There are many factors that may cause a person to wake up with a racing heart. That's the one, with the racing heart in his chest. That's the one. Excuse me. Increases in anxiety and stress levels may trigger the release of hormones in the blood that raise heart rate. Anxiety is a very common cause of heart palpitations. In fact, according to American Family Physician, around 31% of heart palpitation cases are due to a mental factor such as stress, anxiety, or internal conflict. People with high stress lifestyles and those with anxiety disorders might sometimes experience heart palpitations when they wake up. This may be more pronounced during periods of high stress or when anxiety symptoms are worse. though it can also happen out of the blue. People with stress or anxiety may also notice other symptoms, including trouble falling or staying asleep, persistent worrying, difficulty resting, shortness of breath, rapid, shallow breathing. Diet. Diet can have a significant impact on sleep quality and specific types of food, especially if a person eats them at night, can increase the risk of waking up with heart palpitations. Sugar before bed. Consuming sugary foods before a nap or before bed may cause a person to wake up with their heart racing. The body absorbs sugar easily, and eating sugary foods can lead to a spike in blood sugar levels. This extra sugar in the blood may cause the body to release stress hormones, which can cause similar symptoms to those of stress. Caffeine. Caffeine consumption may also cause heart palpitations in some people. The stimulant, which is present in coffee, tea, and soda, may cause the heart to race. A person may also experience symptoms such as jitters, nervousness, anxiety, trouble falling or staying asleep. Dehydration. Dehydration can also cause an irregular heartbeat. Minor dehydration may cause symptoms such as thirst, a dry mouth, and a decrease in urine output. If the dehydration gets worse, a person may also experience a rapid heart rate, rapid breathing, and low blood pressure. Alcohol at night. Drinking a lot of alcohol at night may cause a racing heart in the morning, especially after heavy drinking. Alcohol consumption speeds up heart rate, and it can take some time for the body to recover from this. A person may notice other symptoms such as extreme thirst, nausea, muscle aches, headache. Alcohol at night. So here's the list of things again. Extreme thirst, nausea, muscle aches, headache, and fatigue. That can cause those kind of problems. Yep, that's the one. All right. Anemia. People with anemia do not have enough healthy red blood cells circulating in their bodies. This can give rise to a number of symptoms, including heart palpitations. A person may also experience other symptoms such as headaches, general fatigue, shortness of breath, difficulty concentrating, nightmares. A nightmare is a disturbing dream. Nightmares can cause physical symptoms in the body and may cause a person to wake up with a racing heart. They might also experience sweating and shaking. Night terrors can also cause a person to wake up feeling panicked and with a racing heart. They are more common in children than adults. People do not always remember the specific details of these episodes. Sleep paralysis can like paralysis. Sleep paralysis, something like that, can also lead to a racing heart. During these episodes, a person wakes up unable to move. They will usually experience intense fear and hallucinations, and they may also feel a pressure on their chest. If nightmares are the cause, the racing heartbeat will usually subside shortly after waking up. Sleep deprivation. So now, this is what the person will look like at their work, like this. See? Sleep deprivation. Sleep deprivation may cause a number of health issues. A lack of sleep may also cause a person to feel that their heart rate is higher than usual. Sleep disturbances or not getting enough sleep may cause a number of health issues. The next day, the person may also feel that their heartbeat is slightly faster. The Radiological Society of North America note that after just 24 hours of sleep deprivation, study participants experienced increased heart rate and high blood pressure. A lack of sleep may also cause a person to feel that their heart rate is higher than usual. Sleep disturbances or not getting enough sleep may cause a number of health issues. The next day, the person may also feel that their heartbeat is slightly faster. The Radiological Society of North America note that after just 24 hours of sleep deprivation, study participants experience increased heart rate and high blood pressure. Other signs of not getting enough sleep include fatigue, clumsiness, mental fog. That can happen that way. All right, folks. That's it. The lesson is over. I'm going to do the next video, so stick around.